Hey guys, so we have a doctor's report tonight. For years, for the doctor's report, what I used to do was I gave them before the report, they would get a package that said, a brief explanation about subluxation, what we were looking for during their initial exam. They would get from Ogie Roussel, had the initial phases of degeneration poster that had some commentary about how long the problem has been there, how long it would take to correct, and I would circle, that you're phase one, you're phase two, or whatever the case is, and I would write down 3 times a week for 8 weeks at the bottom, something like that, so they had an idea of what the problem was, what type of initial recommendation they'd get, etc. And then the idea of that was that when I talked to them during the report, it would be a bit of a self-discovery because they would start to understand how it specifically applied to them. Because until they know how it applies to them, it's hard for them to start thinking about other people. Nowadays, and then I changed for a few years, and now I've gone back in the last 2 years to giving them something before the report starts again. Now it's a little bit fancier. It doesn't have to be this way, but it's what we have. So we have the X-ray report of findings that comes with the Posture Ray software that I bought, which I really like. The next sheet is, has our mission, talks about subluxation. The subluxation is a condition of less than full light. It's what we were looking for during your initial exam. Then I have the subluxation and nerve chart, and I have highlighted off the main areas of subluxation that we found on them. And then this report goes through and gives them, kind of a normal, and then what their X-ray is, has the green line and the red lines, and then it makes a commentary down there based on that. You have a 91% reduction in your curve compared to normal. This puts increased pressure in your spinal discs, muscles, bones, and nerves. Research has shown that abnormal neck curve positions are associated with early spinal arthritis and disc disease. So you can go through and you can include as many of the X-ray views as you want. So there's a AP thoracic with an open mouth. It measures, the angles and tilts. This is a lumbar X-ray from front to back. And then, again, it tells the different percentages. You can do a lumbar one from the side. Any view, really, you can mark and put in here. For those people that are A-type personalities, it gives an X-ray summary with all the different numbers and statistics things that I would be interested in. And the reason that I put this in here is because I would be interested in it. If it doesn't interest you at all, I don't know that this is authentic for you, but that's why I do it. And so it goes through, and then of course at the end, or I shouldn't say of course, but I always include some type of generalized exercises that people can do. So they come in, they're told to come at about 10 to 5, 5 o'clock. The report starts at 5:15, so they have about 20 minutes to go through this. So it's given to them, so the doctor has some results here for you. I want you to go through these before your report begins. And so you can see them reading, going through, and their spouse is looking over their shoulders and they're pointing at it and whatnot. And so when they get into the report, this whole concept of subluxation is not new to them. The concept of looking at an X-ray is not new to them. And that way it just goes a lot quicker. I can just show this is a normal X-ray, this is an abnormal X-ray, and you can, through the report, they're showing their spouse, this is me, this is me. At first I thought, I wonder, is that going to be a distraction? And as it turns out, it's quite the opposite, really. It allows them to engage even more. So then, once they understand how it applies to them, it's much easier to take them to the next level of who else does this apply to. So I hope you find that helpful. This is what we do give them before a group report. They read it before they ever come in, along with some different emails that we send them between the time of their initial exam and the results. We find that they're well educated. They just kind of get it before they even come. And so what we're presenting to them cements their understanding of it versus introduces it for the first time. I find that method of communication helpful because I don't know if they learn best through reading. I don't know if they learn best through clicking through the email or through listening. And so we kind of nail all those different topics and go from there. Hope you find that helpful. And again, as with every single procedure, figure out, why are you doing it the way that you're doing it? Are you doing it just because you copied what somebody else did? I don't want you to go out and now you just say, okay, well, that's the new shiny penny. That's what I have to do. No, it's not what you have to do. I want you to ask, is that right for you? Does it resonate with you? Does it answer the questions for you and your patient, that they want to have answered on that day? And if it resonates, then give it a try. But as with every procedure, I put it through the filter first about whether or not it's right for you, whether or not it's right for them, and whether or not it's consistent with the environment that you want to create inside your practice. Okay, guys, I hope you found that helpful. We'll see you next time.